Hello everyone, myself Pranshu Bala from Dr. Ullas Patil Medical College, student of second year MBBS, presenting before you the pharmacological actions and process and treatment and poisoning of anticholinesterases. So, topics to be covered are introduction, chemistry and classifications, mode of action that is also known as MOA, pharmacological actions and pharmacokinetics with uses and poisonings. So, let's start with introduction. Introduction. Agents which inhibit CHE that is cholinesterase and protects ACH that is anticholinesterases from hydrolysis are termed as anticholinesterases. They produce cholinergic effects in vivo and potentiate ACH effect both in vivo and in vitro, as you can see it in diagram. Now let's move on to its chemistry. They are esters of carbamic acid and derivatives of organophosphates, but some of anti-CHs are non-carbamates too. So you can clearly see that carbamates and organophosphates are labeled accordingly, and here clearly their structures are also given. Classification. On the basis of their action and chemical structure, they are classified as follows. Anticholinesterases are classified in reversible and irreversible. Reversible based on structures are classified as carbamates and non-carbamates, and irreversible are further classified as carbamates and organophosphates, and examples of are given below. Insecticides, nerve gases for chemical welfare also includes organophosphate, which can further cause poisoning, which we will discuss later, with its uses and treatment. Now let's focus on mode of action, that is MOA. Anti-CHE reacts with enzyme same as ACH. It is very important point to know. Carbamates and phosphates esterifies their respective sites during the course of their action, and by esterification they develop a bond. Acylated enzymes act rapidly, while carbamates and phosphates react slightly slowly. Carbamates and phosphates react slightly slowly. It is a very crucial point to be noted here. Now let's focus on pharmacological actions. In ganglia, high doses cause persistent depolarization of nicotinic receptors, and further action cause blockade of the transmission. And if the blockade of transmission is done, then no nerve signal will be passed onto the further neuron, and thus loss of sensations can occur. On CVS, muscarinic action causes bradycardia and hypotension, and if ganglionic stimulation increases heart rate and BP. Thus, its action on CVS, that is on heart, both increase in blood pressure and decrease in blood pressure can occur, which signifies that it is very complex to say whether it specifically to bradycardia or tachycardia. Now let's move on to the next, that is skeletal muscle. With the onset of action, twitching and fasciculations are seen. But with onset of action or with the higher doses, weakness and paralysis are noted. So here we can again note that again a contraindication is noted. With the less dosage or with the onset of the action, twitching and fasciculation are seen. But with the onset of the action of higher doses, weakness and paralysis is noted. And weakness and paralysis can be one of the major causes of its higher doses, negative causes. Now let's focus on this pharmacokinetics. First is cyclostigmine. It is absorbed from GIT, penetrates cornea easily, and also crosses blood-brain barrier. As it crosses cornea and blood-brain barrier, thus it can be used in eye infections. Neostigmine. It is poorly absorbed orally and does not penetrate blood-brain barrier or cornea. Thus, neostigmine and cyclostigmine are controversial in penetrating blood-brain barrier or cornea. Next, organophosphates. Organophosphates are observed from all over the body, including lungs and skin. Thus, as I have already said that it is been absorbed by all over the body, and we have already noted that it is used in insecticides and pesticides. Thus, it can be very much harmful for the farmers. Thus, the case noted of organophosphates poisoning is generally of the farmers working in the field with insecticide and pesticides, or the workers who are in making of insecticides and pesticides. Precautions. Anti-CHE are contraindicated in sick sinuses, AV conduction defects, and hypotensive states. They are to be used cautiously. They are to be used cautiously, specifically in peptic ulcer, hypertension, asthma, and COPD, that is coronary obstructive pulmonary disease, which includes mainly emphysema. Now, let's focus on its uses. As I have told earlier, we will focus on its uses. It is used as miotic, that is pilocarpine. It is used in myasthenia gravis, and its best example is neostigmine. It is used in post-operative paralytic ileus or urinary retention. Thus, one more use can be noted, that it is used post-operative infections. And best example of it is neostigmine. In post-operative decurarization, again neostigmine has been noted. In case of cobra bites, atropine plus neostigmine is noted. So, in case of cobra bites or any snake bites with poisonous snake bites, first line of treatment is atropine plus neostigmine. In Alzheimer's disease, it is also used in Alzheimer's disease. Now let's focus on the poisoning. The poisoning of anticholinesterases are mainly focused with the use of organophosphates, as I have earlier told that it is generally caused in farmers and workers who are in daily contact with the insecticides and pesticides. Poisoning can cause irritation of eye, fall in BP, muscular fasciculation, convulsion, and even coma and ultimately death. So how should we cure the poisoning? Now, treatment of action. First, we will have to maintain the patent airway to focus that lungs get the fresh air and oxygen. Next, we should maintain BP and hydration, which are the symptomatic reliefs. Next, control of the convulsions. Then specific antidotes like atropine and cholinesterase reactivators are also used. Next, now let's focus on the MCQs. Now we will focus on how much have you learned. First, anti-CHE are esters of carbamic acid, organophosphates, all of the above or none of this. So its answer is all of the above. As carbamic acid and organophosphates both esterifies their sites to make anti-CHE. Next, acetylated enzyme acts slowly, rapidly, moderately or slightly moderately. So its best answer is rapidly. As we have already noted, slowly actings are carbamic acid and organophosphates. Next, action of anti-CHE on CVS is increase in blood pressure, decrease in blood pressure, or it can be both or none. As I have already said you that it causes the complex action, so it is not sure that it will cause bradycardia or tachycardia, so it can be both depending on the patient. Incorrect statement of the neostigmine. First, it crosses blood-brain barrier, it does not cross cornea. It is absorbed orally or all. As I have already stated that it crosses blood-brain barrier, it does not cross cornea is the wrong statement. It is absorbed orally. So the answer is it does not cross cornea, because it cross cornea and it is used in case of eye infections. Next, in case of cobra bite, atropine is generally combined with neostigmine, pilocarpine, cyclostigmine or none. So best answer is neostigmine. So here are the answers of the MCQs as we have already discussed it. Thank you. Hope you enjoyed the video.